Welcome to today's lecture on abdominal examination. In this comprehensive script, we will dive deep into the intricacies of evaluating various abdominal conditions through clinical examination. We will cover topics such as ascites evaluation, hepatomegaly assessment, splenomegaly examination, liver function tests interpretation, renal angle palpation, mesenteric ischemia assessment, abdominal vascular auscultation, paracentesis technique, hernia evaluation, bowel sounds analysis, masses and tumors detection, and percussion and resonance interpretation. Ascites is a condition characterized by the accumulation of fluid in the peritoneal cavity. It can arise from various etiologies, including liver disease, heart failure, malignancy, and infection. During the abdominal examination, special attention is given to the clinical presentation of ascites, such as abdominal distension, shifting dullness, and fluid thrill. Diagnostic methods, including abdominal ultrasound, paracentesis, and laboratory analysis of peritoneal fluid, aid in confirming the diagnosis and identifying the underlying cause. Hepatomegaly refers to an enlarged liver, which can be caused by numerous conditions, ranging from viral hepatitis to alcoholic liver disease. The assessment of hepatomegaly involves careful inspection, palpation, and percussion techniques to determine the size, texture, and shape of the liver. Additionally, associated clinical findings, such as jaundice or hepatocellular carcinoma, provide valuable clues to the underlying pathology. Splenomegaly, characterized by an enlarged spleen, can be encountered in various conditions, including infectious diseases, hematological disorders, and infiltrative disorders. During the abdominal examination, the evaluation of the spleen involves assessing its size, tenderness, and consistency. Furthermore, considering the differential diagnosis helps determine the primary underlying cause and guides further investigations. Liver function tests provide valuable information about liver health and potential underlying liver diseases. These tests include serum enzymes, bilirubin, proteins, and other markers. Interpreting the results aids in assessing liver function and diagnosing conditions such as viral hepatitis, autoimmune liver diseases, and liver cirrhosis. The renal angle palpation is a significant component of the abdominal examination that helps detect renal or urinary tract pathologies. Palpating the renal angle for tenderness or abnormality provides insight into conditions such as pyelonephritis, renal calculi, or renal tumors. Understanding the technique and recognizing abnormalities during palpation are vital in making accurate diagnoses. Mesenteric ischemia is a potentially life-threatening condition, wherein the abdominal organ's blood supply is compromised. Clinical signs, symptoms, and diagnostic methods, such as computed tomography angiography, aid in evaluating this condition. Exploring the means to recognize mesenteric ischemia during the abdominal examination is essential for timely intervention and preventing severe complications. Abnormal vascular sounds, such as bruits or thrills, heard during abdominal examination, can provide significant clues to underlying vascular diseases. Understanding the significance of auscultating for these abnormal sounds and correlating them with conditions like aortic aneurysms or renal artery stenosis is crucial for accurate diagnoses and appropriate management. Paracentesis is a procedure performed to obtain peritoneal fluid for diagnostic purposes. It involves the insertion of a needle into the peritoneal cavity under sterile conditions. Describing the indications, contraindications, potential complications, and interpreting fluid analysis findings are essential for the proper execution and clinical utility of this procedure. Abdominal hernias are common occurrences that require accurate recognition and diagnosis. Different types of hernias, such as inguinal, umbilical, or femoral hernias, have specific physical examination maneuvers and palpation techniques. Understanding these techniques aids in identifying hernias promptly and preventing potential complications, such as bowel obstruction or strangulation. Bowel sounds are an essential aspect of the abdominal examination. Differentiating between normal and abnormal bowel sound patterns is crucial to determine the status of the gastrointestinal tract. Absent or hyperactive bowel sounds can indicate various gastrointestinal pathologies, such as bowel obstruction or paralytic ileus. Abdominal examination techniques, including inspection, palpation, percussion, and auscultation, play a vital role in identifying masses and tumors within the abdominal cavity. Recognizing the etiology and characteristics of abdominal masses is crucial for further investigations and devising an appropriate treatment plan. Abdominal percussion and resonance aid in assessing and localizing abdominal organ abnormalities and fluid accumulation. Understanding the principles of percussion and resonance and their clinical significance enables accurate physical examination findings, interpretation, and guiding further diagnostic workup. In conclusion, the abdominal examination is a crucial aspect of medical practice for evaluating various abdominal conditions. Understanding and mastering the assessment techniques and interpreting findings correctly are essential for accurate diagnoses and appropriate management. By comprehensively covering the topics mentioned above, this lecture aims to equip you with the knowledge and skills necessary to perform a thorough abdominal examination.